Good afternoon, everyone. I'm Jasmine Sewell with the California Senior Medicare Patrol Program, and welcome to today's talk on Medicare fraud. Before I start, I do want to say a disclaimer here. This is my first ever public presentation, so if you can give me a little grace here and there, that would be great. So thank you. And if we can hold off questions till the end, that would be greatly appreciated. So who here in the audience or on Zoom gets those pesky fraud calls in the morning, those scammer calls?
And emails.
And emails or texts, yes. So,
And texts.
And exactly, text. So because of those calls, that's why I'm here to tell you how to protect your Medicare card, because these guys want to get your Medicare number. And I know we have somebody who's going to be on Medicare soon in the audience, so your Medicare card will look like this. So let me put that away. So who is Senior Medicare Patrol? We'll put up the slides here. So Senior Medicare Patrol, we call it SMP for short, and it's a federally funded program by the Administration for Community Living, which is under the Department of Health and Human Services. We've had this grant for 25 years now, since 1997, and every state has an SMP program, including the 4 U.S. territories. Our mission is to empower and assist Medicare beneficiaries, you and your families and caregivers, to prevent, detect, and report healthcare fraud, errors, and abuse. And we do it through outreach, counseling, and education. We offer free presentations like today. We manage a toll-free hotline where you can report fraud. And we refer any cases of suspected fraud to the appropriate investigators. So who is California Health Advocates? So California Health Advocates is our parent organization. We call it CHA. And CHA provides Medicare legislative policy advocacy, as well as training and education, and it's home of the SMP program. Please visit our website listed. We have a lot of Medicare updates on our website and other healthcare resources. And SMP has 3 roles. We attend health fairs and provide public presentations free of cost. We take complaints over our toll-free hotline. And again, we refer potential cases to investigators. And you'll notice I will repeat some information because we really want to drive things home here. SMP outreach. So we have a 3-step outreach message, and that's to protect, detect, report. Protect your medical identity by guarding your Medicare card. Detect errors by reviewing your Medicare summary notices or explanation of benefits. Report suspicious billing by calling me at the SMP toll-free hotline. And we'll continue on with these 3 points. Okay, you got it. Protect. So guard your Medicare card like your Social Security card, like a credit card. Because Medicare loses about $60 to $90 billion in fraudulent claims every year. And that's just the fraud that's reported. Imagine how much is undetected and unreported. So whether you have original Medicare or have a Medicare Advantage plan through an HMO, scammers don't care. They just want to get your Medicare number. Detect. Review your Medicare summary notices and your explanation of benefits for accuracy. Ask yourself, did I receive these medical services on these dates? Do I recognize the name of the provider? Did I receive these services? Were any items charged twice? Checking these statements will reduce Medicare waste and ensure your Medicare benefits haven't been compromised. So get one of our healthcare journal envelopes where you can keep track of those charges. Let me kind of display it here. This has our message, what to check for On the back, you can write all your appointments. Every time you've gone to the doctor, the lab, whoever, you write their name, the date, and what you were seen for. And you could store your Medicare summary notices in here or any other medical documents, and kind of it's to help keep track of things for you. So I'll leave some here at the center. If not, for those of you at home, you could email me and I can gladly send one to you in the mail. And I think my email is on the chat. We'll move on to the next slide. So this is what a Medicare summary notice looks like. I'm sure many of you have seen yours. Check it, like I said, is this a provider you know? Look at the little boxes in red. Did you receive services this day? I know this is an out-of-state Medicare summary sample, but I had a call the other day. Somebody said, I live in Fresno, but I have a charge from a doctor in Washington. I've never been to Washington. So we open a case on that. So check on that to see if you're being charged from some provider you don't know out of state. Do any services appear twice when they shouldn't? Another story, we had a client who actually, she did review her Medicare summary notice. This was just last week. And she said, you know, I went to my podiatrist for a toenail clipping. And when I saw my Medicare summary notice, he charged for an amputation, a toe amputation. So yes, so we definitely had to look into that one. Sometimes it could be an error, but you know, we help and we'll call. And this is our toll-free hotline number if you ever want to report any suspected fraud, or if you have any questions on what you're seeing on your Medicare summary notice or your explanation of benefits. We'll help you do some research, and we can make calls to providers to check things out. And if you call that hotline, you'll most likely talk to me. So let's look at our resources. So if you have a cell phone, if you want to take a few seconds and point your cell phone at that QR code by pressing your camera button, it should take you to our website. This is just something new that we did and we're trying out, and hopefully it works for people. I'll leave it up for a few seconds. I know somebody in the audience is trying.
So if I just take a picture of it?
Try taking a picture and see if it'll take you to our website. You just kind of lightly press it and it'll recognize it. If not, you could always go to our website. It worked, yay. So that should take you directly to our website. If not, I'm pressing the clicker here. This is our website. And on it, once you're on our website, you can sign up. Awesome, it worked. Thank you. So once you're on our website, you can sign up for Medicare updates, fraud alerts, webinar announcements. Every month, we have an educational webinar, and we have guest speakers from other organizations that come and speak to all aspects of Medicare. And all our webinars are free, so sign up today. And you can find additional free resources and materials on our website by clicking that Fraud and Abuse tab on the home page, and that'll take you to our resources, and I'll show them to you. So these are just a few of our materials. And these materials pertain to scams that have come in through the hotline. So anytime there's a new scam, we'll develop some type of flyer to educate people about it. One of them's on genetic testing, that red one, and I actually have that one here too in person.
Oh, really?
Yes.
That's a scam.
Yes, genetic testing, hospice, insurance agent misconduct, all kinds of stuff on our website. And if most of our things are DIY, you can download and print them at home, but if not, you can request them from us and we'll mail some to you. And you can order a batch as well. And if you'd like to order a batch, that'll be on the next slide. Please contact my colleague, Cassandra Ng, and there's her email. If you want to order more than one, you know, if you have a little group that you'd like to share things with, we'll gladly send you whatever amount you'd like.
How would I get another copy of the Medicare card?
You would call Medicare directly, but we can talk about that after. So go ahead and email my colleague Cassandra Ng, and she'll send out supplies to you, materials. And we have our materials in 9 languages. So we have them in English, Spanish, Chinese, Korean, Vietnamese, Farsi, Tagalog, Russian, Armenian. Our upcoming webinars. So we have 3 free Zoom webinars coming up in the next 3 months. Please feel free to sign up for these. Like I said, they're free. Call the number listed there and we'll register you. Chances are I'll probably be picking up the phone and registering you. And this is actually a coupon ad that was sent out yesterday statewide in those Velpack coupon envelopes. So if you get those coupon envelopes, those big ones, it might be in there as well. And the 3 webinars that are coming up, I don't know if you could see them good, but next month will be on Medicare fraud and how to protect your benefits. Kind of like us, but you'll be hearing directly from CMS, which is they're the ones that administer Medicare. And in September, we are going to talk about hospice, because hospice is a big fraud we're seeing right now. We'll get into that in a bit. And in October, since it's open enrollment, the annual enrollment period, we'll be talking about what's new for 2023. So tune in. That might be a good one for you to attend. That one in October. Cases. Okay, this is kind of the nitty-gritty of the presentation. Thank you, Sean, for advancing the slides here. So these are the cases that we're seeing so far this year. We're halfway through the year. What do you see is the highest fraud? I'll give you a few seconds. I know the audience is trying to read the screen too, the in-person audience.
Oh, case advantage plans and agents?
Yes, Medicare Advantage plans and agents. And we're going to get into these different types of frauds. So based on the chart that we just saw, these are the top complaints that we're receiving on the hotline. So let's park it here for a minute and talk about each one of these. So number 1, Medicare Part C and D, so that's Medicare Advantage. Part D is the prescription drug plan. Communications and marketing violations. So number 1, so insurance agents, beware of aggressive insurance agents who use pressure tactics that may provide you false information just to get you to join their plan. We're not against insurance agents. I just want to be clear. I know that most of them are amazing, but we are against aggressive agents. Number 2, deceptive hospice enrollments. So what's hospice? Hospice is when your doctor has certified you terminally ill and you have 6 months or less to live. And Medicare pays for hospice. Scammers are abusing this benefit and ripping off taxpayers and harming Medicare beneficiaries. What they're doing is some hospice agencies are targeting senior communities, apartments, many where seniors have limited English proficiency and don't meet the hospice criteria. And these seniors are tricked and they get enrolled into hospice under the guise that they're enlisting in a Medicare program that offers, free things, some freebies, right? So these freebies that get offered to them are nurse visits at home, groceries delivered, cooking and cleaning, bus coupons. One person was even offered $400 a month, while another was told she qualified due to her age alone. These freebies are appealing, but beneficiaries later face the inability to see their specialists or access their medications at the pharmacy. So beware of freebies, because resolving the issue and removing someone from hospice is not a fast process. It takes time. And these are real cases that we're seeing. I didn't make this up. These are real calls that have come in. Number 3, billing issues. So again, review your Medicare statements for accuracy. If you suspect you're being billed fraudulently, give us a call. Number 4, Medicare card phone scams. So scammers call beneficiaries and tell them that Medicare wants to send them a new plastic card or a card with a chip in it. But first, they need to verify your Medicare number. So watch out for that.
Oh, so on the phone, there should be no volunteering information about your Medicare number. They should know it if they're calling.
Right. Medicare will never call you.
Okay.
So if somebody says, hi, I'm calling from Medicare, Medicare is offering new plastic cards or a card with a chip in it, but I need to verify your Medicare number just to make sure that's who you are, you know, it's you. That's where they get you. Medicare does not call.
So Medicare never calls?
No.
You would not believe the many people that's called me saying that they're Medicare. And I always tell them, my Medicare plan is fine, no thank you, and I hang up.
Okay. And Social Security or the IRS will not call you either.
I can't believe all these people been calling me.
Yes, and I will.
Just cut them off.
Yes, that's the right thing to do. Hang up.
Yeah.
Just hang up. And, you know, we tell, you know, a lot of the seniors, we know some seniors don't like to be rude to people, but this is okay to be rude this time, okay? Just hang up on them,
Yeah,
especially if they're being pushy.
I just didn't know that Medicare never calls. I didn't know that
Right.
Social Security never calls. Nobody ever told me that.
Right.
But I always know that my information, my business is already handled with them. I don't want to change my plan. I'm not trying to get a better rate, which is what they always tell me.
Right.
I can help you get a better rate, but first let's verify information. No, thank you. I will go straight to Kaiser and take
Right.
care of it there.
So that takes us, what you're talking about, it sounds like fraud number 1 there about the Medicare Part C when they're trying to sell you a different plan, trying to find you a better rate. Yes. Moving on, I think we are on, number 5, genetic testing scams. So this is usually a phone scam, and they tell you that Medicare will cover a genetic testing scam. It's just a swab to check for cancer. I even heard of Alzheimer's and also cardiac, if you have any heart issues. Medicare won't cover this unless your doctor orders it. And these are expensive tests, so if you get these type of calls, hang up, okay? Your doctor has to order these. And we'll dive even deeper into these issues. Brace scams, it says DME brace scans, and DME stands for durable medical equipment. That's another one. These are phone calls that people are getting, and the caller says, oh, are you in pain? Does your knee hurt, your wrist, your elbow? Are you in pain? And, you know, seniors sometimes will say, oh, yeah, well, yes, I am. And, you know, once these people get their Medicare number, they're going to start receiving a lot of braces, and they can accumulate thousands of dollars of braces. They'll start sending products out to you. And guess what?
Then the billing starts.
Then the billing to Medicare starts, yes. And many people, other victims have responded to postcards about this, TV commercials, sometimes unannounced home visits, and they all gave up their Medicare numbers to these strangers. So again, hang up. Okay, next one. So this is another flyer that we developed due to aggressive agents that were misinforming beneficiaries and pressuring them into signing up for one of their Medicare Advantage plans, you know, with promises that their current doctor is on that plan that they're trying to sell, you know, that doctor is in their network, only to find out they're not. We get many calls about this. Well, somebody sold me a Medicare Advantage plan and they told me my doctor was on it, but when I went to my doctor, they said, no, they don't accept that insurance. So try, you know, don't feel pressured by anyone. Hang up. And no one should be knocking on your door either, so don't open it. If you want more information about health plans, Medicare Advantage plans, I suggest you call HICAP. And I believe here at ACC, HICAP is here on Wednesdays, and you can call the office to make an appointment. And I'm going to leave you their number. Sean, if you could put it in chat.
So who is this that you're leaving the number
For
for?
HICAP. HICAP is the Health Insurance Counseling and Advocacy Program. They do Medicare benefits counseling.
Okay.
And they're here on Wednesdays, but you need to make an appointment.
They're called HICAP?
HICAP, HICAP. Oh, their number's right there. I'm sorry, it's on my slide. The 1-800-434-0222. But let me give you the direct Sacramento number.
Okay.
And Sean's going to type it in the chat here. So it's 916-376-8915.
And what's the person's name I'll be talking to?
I'm not sure who answers the phone
whoever
over there.
answers the phone.
Yeah, just tell them you want to make an appointment with a HICAP counselor.
So do they sit down with you and try to figure out what's the best plan for you?
Yes. So HICAP, what they do, we just had an audience question. They can counsel you on benefits. They'll present to you all your options. It's free and unbiased counseling. And then from there, you make your decision on what you want to go with. If you want to go with original Medicare, or if you want to go into a Medicare Advantage plan. And they cover other topics too, like supplemental plans and long-term care insurance, as well as Part D plans, the prescription drug plans. Okay, moving on to the next slide. So we're going to go back to hospice here. This is the second highest fraud that we're seeing right now, that, the calls that are coming in to me on the hotline. So some hospice agencies, as I mentioned, are misrepresenting themselves. They're not calling themselves hospice agencies. Instead, they're calling themselves, if you look on the slide, they say they're a government program out to help seniors during COVID. They're an assistance program, a cooking and cleaning agency. They offer incentives in exchange for your Medicare number. The incentives are the cooking and the cleaning services, free wheelchairs, shower chairs, medications delivered at home, free shampoo, lotion, gloves, hand sanitizer, masks.
So do they actually, once they give information, do they really start sending meds or all the freebies and all that?
Yes.
But there's a billing that comes with it.
Yes, and there's more to it, and I'll get to that too. So yes, they'll give you all these incentives, nurse visits at home, and what I've heard from some beneficiaries, they'll say, oh, the nurse started coming for the first couple of months, but they don't show up anymore, but they're billing Medicare still. And the other incentive is they can give you money. I think I mentioned in the previous slide that somebody was getting $400 a month for signing up for hospice. But what can happen if you are signed up for hospice and you're not terminal? You have false promises, controlled medications, controlled drugs. They start giving you morphine. What are some of the, like Ativan, those types of medications?
Even without having a diagnosis,
Right.
they
They
send
use,
medicine?
they have their own doctors, but these are not coming from your doctor. So, and we'll talk more about that too. Yes. And what happens when you're in hospice, it's hard for us to help disenroll you. We can do it, but it takes time. It's not something that can just be done right away. And you can be really sick during that time, and you want to go to the ER, or you want to go get your diabetes medication, and you can't get it because the pharmacist will say, you're on hospice. I can't give you your medications. Go to your hospice agency. And your curative health care is denied. If you're dying, why do you need curative health care, right? So, yeah, hospice is the only benefit where Medicare will cut off other curative care, so be aware. Now we're changing gears here to billing complaints. So if you look on the slide here, these are some of the billing complaints that came into us and we assisted them. And if you see, again, if you see something that's not right on your Medicare summary notice or explanation of benefits, give us a call. We'll look into it. And again, new Medicare card complaints. These are those cold calls. So don't fall for this scam. If they tell you that Medicare benefits, oh, this is the other one, they'll tell you, your Medicare benefits will be suspended if you don't verify or confirm your Medicare number. Hang up on these guys. You've heard that, okay. Yeah, don't believe it, no. So Medicare has not changed their card. It's still the same little paper card. It's like a little thick paper. It hasn't changed. And I don't think they're going to be issuing out any plastic cards anytime soon. Cardiac genetic testing, we spoke about that earlier, and we're talking about it again. So as previously mentioned, we've received many calls about this scam. This past fall, I'd say September and October, our hotline was just nonstop with many cardiac genetic test kit scams. These scam calls, they were offering genetic test kits, and they'll tell Medicare beneficiaries, as you see on the slide right there, oh, your doctor ordered a cardiac genetic test kit for you, to screen for cancer or heart disease. Medicare's issuing new Medicare cards with added benefits such as genetic testing. Get yours today. And all they need to send out this kit is your Medicare number, your date of birth, and your doctor's name. And before you know it, you'll receive this test kit at home, and they want you to, and they will follow up asking you if you did the swab. So if you get one of those, return it or refuse the package. But call us first so we can get the information on the box. Back braces, again, back to the brace issue here. It's usually a scam call asking you if you have pain. They offer you the braces and that Medicare is going to pay for them. And sometimes they have a doctor that will sign off on these orders. And once they get your Medicare number, you're going to get inundated with thousands of dollars worth of braces. You're going to have boxes, and they're going to keep coming, and all while they're billing Medicare for these braces that you don't need. So hang up on them. COVID-19 complaints. So beware of any fake surveys that you get by email or text asking you bogus vaccine questions. Watch out for vaccine offers where money is being asked up front. We're currently helping a senior right now to get his money back from a clinic that charged him up front for his COVID vaccine. No. So, and also, if you look at the picture, beware of these type of pop-up test sites, like the one in the picture. I haven't really seen any in the areas of Sacramento that I'm around, but I have seen them in other cities. Next slide here. Non-healthcare scams. So these are not Medicare related, but we feel it's important that you know about these types of scams as well. Like we were talking about, the IRS, Social Security won't call you, government officials won't call you, and I'm sure you've heard about these already. These imposters pretending to be IRS agents or police saying that they have a warrant out for your arrest if you don't pay a fine. I'm sure many of you have heard of this scam. And one scam that I see is not on there, and we forgot to add it onto the slide, is the Grandparent Scam.
Right.
Has anybody heard of that one?
Yes.
So this is where somebody's calling you pretending to be your grandkid, and they say, right, Grandma, I'm in jail in Tijuana. But I need your help, but don't tell Mom or Dad because they're going to get mad. But I need you to bail me out and wire me some money, right? So if this happens, please report it to the Federal Trade Commission. Their number's on there.
Is the number right there?
The number's on the slide, yes. And don't forget to sign up for the Do Not Call registry, to try and stop all those marketing and robocalls. You know, that robocall about the extended warranty for your car?
Still doesn't really work.
I know. I hear sometimes it doesn't work, but sign up for it anyway. And I think we've come to the end of my brief presentation here. So to book a presentation with us and to report fraud, our number's right there. Outside of California, the number's also listed. And to access our webinars, alerts, newsletter, go ahead and go to our website and sign up. And to order materials, contact Cassandra Ng. Thank you for attending this talk. Like I said, you're now empowered to protect and detect and report Medicare fraud. And if any of these frauds have occurred and you want to file a confidential report, please go ahead and call me at that hotline number or email me, and I will contact you and we can do a report. Thank you to ACC staff for inviting me here today. It's been a pleasure. Thank you. If you have any questions, I can try to take any.
Can you leave that slide up?
Yes, we're going to leave that slide up, and while we're waiting for questions,
I have a question.
Okay, yes.
For outside organizations, church affiliations and people like that, do you come to those locations and do presentations for community?
Yes, so we do community. The question was if, I don't know if they heard it on Zoom, if we do community presentations like at churches and things like that. Yes.
For a fee or free service?
It's all free.
Okay. So,
Yes, Senior Medicare Patrol does free presentations. If it's not me, it would be one of our volunteers. And we could do it in English. I could do it in English and Spanish. So while we wait for additional questions, one of the things that I'm leaving here, I'm leaving some brochures, pens, and other things that here at ACC. Next time you're here, you can grab one or take one today. But we have this little, we call it the medical ID card, but you can write all your prescriptions and dosages here and any allergies and your information and put it in your wallet. I know my mom has to take a list of medications with her every time she goes to the doctor, so this is very helpful to have, and just put in your wallet. And like I said, you can take one of these envelopes, we can mail them to you. We have flyers, we have pens, you name it. I have a lot more at the office. I just didn't want to bring everything today, so thank you. Any questions, Sean, from online? If not, you can confidentially email me as well.
Could you please put up again the slide prior to the last one? Because I was taking notes on the FTC consumer response telephone number, and the last slide came up. So it was prior to the last slide.
Okay, we have it up now. And if you'd like a copy of these slides, we can send them out to you. You could put a chat in there, and Sean here at ACC can email it out to you. Or I can too as well.
Well, I'm not online right now, so I couldn't put my information in the chat.
It's okay, I can take your information and send you a copy to refer back to it. And I'm trying to look at the chat too here. I gotta put my glasses on. Oh, you're welcome. Thank you for attending. We'll just hang out here for a little bit.
So if we want to request for copies of these slides, we will contact Cassandra Ng.
You can, yes, or call the 800 number, or email me. And my email's on the chat. You could email me as well, or contact Cassandra Ng.
Oh, okay.
Mm-hmm.
Thank you. Thank
You're
you.
welcome. You're welcome.
You're Sandra Ng.
I'm Jasmine Suo. Cassandra Ing's my colleague at the office. Yes. So if you call a hotline, it's going to be either one of us that answers. Mhm. And if you get the voicemail, go ahead and leave a message, and I will call you back as soon as possible.
Okay. We'll just mention the slides of the presentation, today's presentation,
Yes.
what you will be sending out.
Yes, so I would send you the slides. And if you want to request any of the materials that I showed, you could, if you want to get one of these envelopes mailed to you to put your information or to list your medications, just put the little medication folding card in the healthcare envelope, and we'll know what you're saying. And we'll mail it out to you.
Healthcare envelope.
And it's all free, by the way.
Okay. Yeah, thank you.
Thank you for attending.
You're welcome.
Well, thank you again, everyone. It's been a pleasure to be here and, empowering you to look closer at your Medicare summary notices and detecting and reporting any fraud. And thank you to the audience. And I hope to come back again soon. Thank you.
Thank you so much. Thank you.
Thank you.